The last element I want to talk about is patient insights, really developing deep organizational capabilities around understanding the patient. And I put this last on purpose. It's because I hope everyone here is already doing this, right? I hope everyone here has an understanding of what their key patient needs are and is talking to patients, doing patient market research, et cetera. But I'll ask, before I go to this, the last thing. Does everything you do tie back to patient insights in your organization? So as I go to my slide here, I'll just show how this kind of builds out. So, patient insights is the last crucial ingredient to really being able to deliver that great patient experience that I talked about Bill having. On top of the technology, analytics, and data set, understanding the key needs of your patient is the kind of secret ingredient to knowing what it is that Bill wants or needs and how you might be able to deliver that. So we believe that understanding a patient really means knowing them as an individual, as a person, sort of understanding how they think, how they feel, how they make their health decisions. And I think a lot of folks are already doing a lot of things right in terms of understanding the patient journey and driving deep patient insights. There are a number of organizations, though, that are starting to build organizational capabilities around new modes and techniques to really dig a little deeper with patients. I'll just mention a couple of them here quickly. So mobile ethnography, the solution we use is called the 365 eJournal, but really is a way to engage with patients over multiple days, times, locations as they experience different aspects of their life, and collect data through video, audio, text, really getting a more holistic picture. We find as we all become more comfortable with our mobile devices following us everywhere that you can get very deeply, deeply personal insights from patients that they share through their phones. Another is workshops. So as opposed to focus groups, really engaging with patients, physicians, and other stakeholders collaboratively to co-create solutions, right? This requires moderators that have different skills than someone who's just following a discussion guide and can really engage in an ad hoc way with patients and other stakeholders to understand how we might be able to better meet their needs. And then finally, leveraging immersion into experiential settings, right? So for example, the HCP patient interaction, put them in a physician's office, put them in a simulated physician's office, have conversations, try different things, see what works to make that dialogue better, and you can similarly simulate other important touch points in the patient experience. So before I show our final survey results, how many people have seen the U equals U campaign? Nobody? Just a couple. Okay, so U equals U is undetectable equals untransmittable. It's a grassroots campaign in HIV to try to educate patients and consumers generally around the virus. And this campaign really brought to mind, to me, the whole nature of the journey with patient-centricity. We think we know our patients, right? I've been working in HIV on and off for over 20 years. But when somebody asked me recently, what's the experience of a patient like after they reach undetectable? I was like, I don't know much about that, right? And I don't know much about that because for 20 years in HIV, we viewed that as the finish line. They're undetectable, right? Isn't that great? The medications have gotten so good that we get them there, but now they can be undetectable for 20, 30, 40 years. What's their experience like? They're still a patient, right? So it's something that reminded me that we always have to be questioning our insights into the patient and how deeply we understand what their experience is, because that experience is changing. All right, so how'd we do on the last survey? Sometimes, great, good, getting there, right? So none of this is easy, right? I don't want to suggest that any of this is quick, easy, or painless, but I'll offer a couple of suggestions as parting thoughts. So first, I think regardless of the organizational structure, make sure that you balance responsibility with accountability, right? Making everyone responsible is great, but make sure that someone is accountable for patient centricity and measuring progress that you're making. And organizational KPIs are a great way to do that, right? Second, balancing the passion between innovative science and great patient experience is a challenge, right? Sometimes the most innovative science doesn't lead necessarily to the easiest patient experience. So thinking about how make sure you're balancing those things. Third, providers, payers, other stakeholders may not be on the same page as you with some of the patient centricity initiatives. I think the AbbVie example is a great one, showing there are ways to get everybody on the same page to demonstrate that it can be win-win-win. Fourth, it's hard to uncover deep patient insights. We have to remind ourselves that the patient landscape is changing all the time. We need to continuously seek to understand what their needs are by talking to them directly using new techniques. And finally, get out in front of the data privacy, regulatory, and legal concerns that you're inevitably going to run into. Work with your regulatory and legal teams to think about how you can consistently engage with patients in a way that still leaves you able to maintain compliance, obviously.